Local anesthetics are chemicals that reversibly block action potential in all excitable membranes. The central nervous system and the cardiovascular system, therefore, are especially susceptible to their action. Most of the systemic action of the local anesthetics are related to their blood or plasma level in the target organ. Higher the level, the greater will be the clinical action. Local anesthetics are absorbed from their site of administration into the circulatory system, which effectively dilutes them and carries them to all cells of the body. The blood level of local anesthetic is influenced by the following factors. Number 1, rate at which the drug is absorbed into the cardiovascular system. Number 2, rate of distribution of the drug from the vascular compartment to the tissues. And lastly, elimination of the drug through metabolism or excretory pathways. These drugs readily cross the blood-brain barrier. Their pharmacological action on the CNS is seen as depression. At low level, there is no significant CNS effect noted. At higher toxic dose, the primary clinical manifestation is generalized tonic-clonic convulsion. Between these two extremes condition, there is preconvulsive phase noted. Some local anesthetic also demonstrate anticonvulsant properties. Procaine, mepivacaine, lidocaine have been used intravenously to terminate or decrease the duration of both grand mal and petit mal seizure. Epileptic patient possess hyperexcitable cortical neurons at the site within the brain which called epileptic foci where the convulsive episode originates. Local anesthetic by their depressant action on the CNS raises the threshold for seizure by decreasing the excitability of neurons, thereby preventing or terminating the seizure. Anticonvulsive level for lidocaine in blood is 0.5 to 4 microgram per ml. Pre-seizure sign symptoms develop at the level of 4.5 to 7 microgram per ml and more than 7.5 microgram per ml causes tonic-clonic seizure. When local anesthetic concentration in blood increases, then the therapeutic level preconvulsive sign symptoms develop. The signs are slurred speech, shivering, muscle twitching, tremor of muscles of face and distal extremities, generalized lightheadedness, dizziness, visual disturbances, auditory disturbances like tinnitus, drowsiness and disorientation. Patient develops the symptom of numbness of tongue and the circumoral region, warm, flushed feeling of skin, pleasant dreamlike state. Further elevation of local anesthetic blood level leads to development of tonic-clonic convulsion. Both cerebral blood flow and cerebral metabolism are increased during the local anesthetic induced convulsion. Increased blood flow to the brain leads to the increase in the volume of the local anesthetic being delivered to the brain, tending to prolongation of the seizure. Increased cerebral metabolism leads to progressive metabolic acidosis as the seizure continues, and this tends to prolongation of the seizure activity. This occurs even in the presence of declining local anesthetic level in the blood. As noted, the dose of local anesthetic necessary to induce seizure is markedly diminished in presence of hypercarbia or acidosis. Further increase in local anesthetic blood level result in cessation of seizure activity as EEG tracing becomes flattened, indicative of generalized CNS depression. Respiratory depression occur at this time, eventually leading to respiratory arrest if anesthetic blood level continue to rise. Now the question may come, how can a drug that depresses the CNS be responsible for production of varying degree of stimulation including tonic-clonic convulsion? The cerebral cortex has pathway of neurons that are essentially inhibitory and others are excitatory. A state of balance normally is maintained between the degree of effect exerted by these neuronal paths. At preconvulsive phase, the local anesthetic selectively depresses the action of the inhibitory neuron that leads to development of the tremor and slight agitation. At higher blood level, inhibitory neuron function is completely depressed, allowing unopposed function of the excitatory neurons that develops the tonic-clonic activity. Further increase in the anesthetic blood level leads to the depression of excitatory as well as the inhibitory pathway, producing the generalized CNS depression.